welcome to the channel Simple Nursing Concepts. Today we are going to discuss one of the important topic, that is UTI, urinary tract infection. So in this session we are going to discuss with respect to the introduction, definition, what may be the etiological and risk factors, classification, pathophysiology, clinical manifestations, diagnosis and management. First one, introduction. Urinary tract infection is an infection in any part of the urinary system. So you consider the urinary system, so there will be certain parts respectively. So these things, so kidneys, ureter, bladder and urethra. So any infection among these things, so it can be urinary tract infection. So there are lower urinary tract of the bladder and the urethra is most commonly occurs, and women in the age group of 20 to 50 are at higher risk to get the infection than the men. So as compared to the men, here women are having more risk of affected with the UTIs. So one of the major infecting organism is E. coli. Okay, so let us discuss about definition. So urinary tract infection is defined as a condition in which the bacteria overgrow in the bladder, ureter, urethra or the kidney. So any infection which is by any bacteria, so which overgrows in the bladder, ureter, urethra or in the kidneys, so it can be considered to be as urinary tract infection. So this is the structure of the urinary tract system. So most common etiological factors for the UTI. So one is Escherichia coli, that is E. coli, Klebsiella, Proteus mirabilis, Pseudomonas aeruginosa, Staphylococcus saprophyticus, Streptococcus agalactiae. So these are some of the etiological factors. So Escherichia coli is one of the major bacteria which is in gram-negative, bacteria. So risk factors. So there are certain risk factors for the development of UTI. The first one is heterogenic or some of the drugs factors like indwelling catheter. The person with indwelling catheter or some of the antibiotics may lead for the infection. Next, some of the behavioral factors like voiding dysfunction, frequently or recent sexual intercourse, also the one of the risk factors. And anatomical and physiological factors like being the female sex itself is the risk for the development of UTI, and in cases of pregnancy, vesico-urethral reflex also the things. Genetic factors, some of the familial history or tendency, susceptible uroepithelial cells also the risk factor. So classification, next content is classification, that is lower urinary tract infections. So lower urinary tract infection include bacterial cystitis, prostatitis and urethritis. So in upper urinary tract infections are much less common and include acute and chronic pyelonephritis, intestinal nephritis and renal nephritis. So we can divide the urinary system into two parts. So one can be lower urinary tract infections and another one will be upper urinary tract infection. And third one is uncomplicated lower or upper urinary tract infections. Most uncomplicated UTIs are most common uncomplicated UTIs are community acquired and are common in young women but not usually recurrent. So as name suggests, so these are not develop the complication. Next one, complicated lower or upper UTIs. Complicated UTIs usually occur in people with urologic abnormalities or recent catheterization and are often acquired during the hospitalization. So any cases which are happened during the hospitalization or due to the catheterization, uh, that may be the complicated lower or upper urinary tract infection. Next, pathophysiology. So this is the simple picture of the pathophysiology. Simple. So any bacteria or etiological factor which leads to the access. So it enters to the urinary tract and adhere to the bacteria adheres to the epithelium and colonizes. So epithelium and makes colonization and develops. Evasion. So host defense mechanisms are bypassed. So whenever any bacteria enters the body, so there will be host defense mechanism develops. But here the host defense mechanism is passed by the bacteria, so which leads to the inflammation. So for the inflammation there will be an immune reaction, inflammation, and some of the infection signs are present. So some of the clinical manifestations like burning or urination. So patient may feel the pain while urination. Next, frequency, the more than 3 times, usually every 3 hours. So whites more than the usual every 3 hours. So patient frequency, the patient whites more than the usual every 3 hours. Next, nocturnia, in the sense nighttime urination, so that is nocturia. Next, suprapubic or pelvic pain. So this is also one of the sign and urgency. So diagnosis as the things. So first one will be history collection. So patient complains of fever, lower back pain, lower abdominal discomfort, history of recent surgery or history of sexual intercourse, invasive procedure through the urethra, diabetes and kidney diseases. So you collect the history with respect to these things. Physical examination, so related to the signs of UTI, pain, irritation, burning, micturations. Other things are urine culture. So urine culture, it is also one of the important thing for the detection of the bacteria present in the urine. Some of the STD tests, sexually transmitted diseases tests we can done. CT scan. A CT scan may detect pyelonephritis or abscess, whether the presence of pyelonephritis or abscess. Next, USG for the detection of any obstruction or any abscess, tumors or cyst present in the urinary tract. Management. So management can be divided. So first one will be your pharmacological management. So for pharmacological management, treatment for urethritis is ceftriaxone 250 mg IM, along with that plus azithromycin 1 gram per oral once, or doxycycline 100 mg per oral BID for 7 days. BD dose we have to provide for 7 days. Next, for the cystitis, nitrofurantoin 100 mg per oral BD for 3 days. So if it is contraindicated if creatinine clearance is less than 60 ml per minute. Treatment for acute pyelonephritis managed in OPD with antibiotics if the patient without nausea and vomiting, no symptoms of complicated UTI, treated by ciprofloxacin 500 mg per oral BD for 7 days, or trimethoprim or sulfamethoxazole 160 to 800 mg per oral BD for 14 days. And other some of the non-pharmacological interventions can be done, like you need to educate the patient to drink plenty of water. So use and educate the patients or educate the persons to use the protection while sexual intercourse, and avoid to wearing the tight fitting cloths, clean the genital regions, and contact the healthcare provider if you have any difficulty during the emptying of the bladder. So that's been this class. Thank you for watching.